My name is Eliza Ashley Salta, so today I'm going to be doing the procedure bed making and Unoccupied. So today is I will assemble the equipment and arrange on a bedside chair in the order in which item will be used. So the rationale for this is organization facilitates performance of tasks. And then next is I will perform hand hygiene and put on PPE as indicated. So the rationale for this is hand hygiene and PPE prevents the spread of microorganisms, and PPE is required based on transmissions precaution. Then next is I will adjust the bed into a comfortable working height, usually elbow height of the caregiver or the nurse, and drop the side rail. So the rationale for this is having the bed at the proper height prevents back and muscle pain. Having the side rails down reduces strain on the nurse while working. So assume that I already adjust the bed into a comfortable working position and put down the side rail. I will disconnect hall belts or any tubes from the bed linen. So the rationale for this is disconnecting devices prevents damage to the devices. So assume that I already disconnect any hall belts or any tubes from the bed linen. Next is I will loosen all linen as I move around the bed from the head of the bed on the far side to the head of the bed on the near side. So the rationale for this is loosening the linen helps prevent tugging and tearing on the linen, and loosening the linen and moving around the bed systematically reduce the strain caused by reaching across the bed. And then next is I will fold the reusable linens such as sheets, blankets, or spread in place on the bed and hang them over a clean chair. Snugly roll all the soiled linen inside the bottom sheet and place directly into the laundry hamper. Do not place on floor or any furniture. Do not hold soiled linens against my uniform. So possible, I will shift the mattress up to head of bed if mattress is soiled. Clean and dry according to the facility policy before applying a new sheet. So the rationale for this is this allows more foot room for the patient. And then next is I will remove my gloves unless indicated for transmission precautions. And then I will place the bottom sheet with its center fold on the center of the bed. Open the sheet and fan fold to the center. And then next is if using place the draw sheet with its center fold in the center of the bed and position so it will be located under the patient's midsection. I will open the draw sheet and fan fold to the center of the mattress. If a protective pad is used, place it over the draw sheet in the proper area and open it in the center fold. Not all agencies use draw sheets routinely, so the nurse may decide to use one, and in some situation or institution, the protective pad doubles as a draw sheet. So the rationale for this is if the patient soils the bed, draw sheet and pad can be changed without the bottom and top linens. I will fold the bottom sheet over the corners of the head and foot of the mattress. Tuck the draw sheet securely under the mattress. So the rationale for this is making the bed on one side and then completing the bed on the other side saves time. Having bottom linens free of wrinkles reduces patient discomfort. Next is I will move the other side of the bed to secure the bottom linens. So I will pull the bottom sheet tightly and secure over the corners at the head and foot of the mattress. I will pull the draw sheet tightly and tuck it securely under the mattress. So the rationale for this is this removes wrinkles from the bottom linens, which can cause patient discomfort and promote skin breakdown. Place the top sheet on the bed with its center fold in the center of the bed and with the hem even with the head of the mattress. I will unfold the top sheet, follow same procedure with top, blanket, or spread, placing the upper edge about 6 inches below the top of the sheets. The rationale for this is opening linens by shaking them, spread organisms into the air. Holding linens overhead to open them causes strain on the nurse. And then next is I will tuck the top sheet and blanket under the foot of the bed on the near side and then meter the corners. The rationale for this is this saves time and energy and keeps the top linen in place. And then next is I will fold the upper 6 inches of the top sheet down over the spread and make a cuff. So the rationale for this is this makes it easier for the patient to get into the bed and pull the covers up. Next is I will go to the other side of the bed and follow the same procedure for securing the top sheet under the foot of the bed and making a cuff. So the rationale for this is working on one side of the bed at a time saves energy and is more efficient. And then next is I will place the pillow on the bed, open each pillowcase in the same manner as I opened other linens and gather the pillowcase over one hand toward the close end. I will grasp the pillow with the hand inside the pillowcase, keep a grasp firm hold on the top of the pillow and pull the cover onto the pillow. I will place the pillow on the head of the bed. So the rationale for this is opening linens by shaking them causes organisms to be carried on air currents. So covering the pillow while it rests on the bed reduces strain on the nurse's arms and back. And then next is I will fan fold or pie hold the top linens. So the rationale for this is having linens open make it more convenient for the patient to get into the bed. So next is I will secure the signal device on the bed according to the agency policy. So the rationale for this is the patient will be able to call for assistance as necessary and promotes patient comfort and safety. So assume that already secure the signal device on the bed. And then next is I will raise the side rail and lower the bed. The rationale for this is it promotes patient comfort and safety. So assume that already raise the side rail and lower the bed. And then next is I will dispose the soiled linens according to the agency policy. So the rationale for this is it deters the spread of microorganisms. So assume that already disposed the soiled linens. Then next is I will remove any other PPE if used and perform hand hygiene. So the rationale for this is removing PPE properly reduces the risk for infection, transmission, and contamination of other items. Hand hygiene prevents the spread of microorganisms. The procedure, bed making occupied. So first is I will check chart for limitations on the patient's physical activity. So the rationale for this is this facilitates patient's cooperation, determines level of activity, and promotes patient safety. Next is I will assemble equipment and arrange on bedside chair in the order of the items will be used. So the rationale for this is organization facilitates performance of tasks. Next is I will perform hand hygiene. I will put on PPE as indicated. So the rationale for this is hand hygiene and PPE prevents the spread of microorganisms. PPE is required based on transmission precautions. And then next is I will identify the patient. I will explain what am I going to do. So the rationale for this is patient identification validates the correct patient and correct procedure. And so hello po, my name is Eliza Ashley Satter and for today I know your name po, your birthday. May I check your ID band po for verification? Okay, thank you po. So, ang gagawin po natin procedure today is papalitan po natin yung inyong mga linens po sa bed. Is that okay with you po? And then next, I will close the curtains around the bed and close the door to the room if possible. The rationale for this is this ensures the patient's privacy. Next is I will adjust the bed to a comfortable working height, usually elbow height of the nurse. Next is I will lower the side rail nearest me, leaving the opposite side rail up. Place bed in flat position unless contraindicated. And then next is I will check bed linens for patient's personal items. I will disconnect the call bell or any tubes or drains from the bed linens. So now, I will check the bed linens for the patient's any personal belongings. And then next is I will place a blanket or bath blanket over the patient. Have patient hold on the bath blanket while I reach under it and remove top linen. So leave top sheet in place if a bath blanket is not used. I will fold linen that is to be reused over the back of the chair and discard soiled linen in laundry bag or hamper. Do not place on the floor or any furniture and do not hold soiled linens against my uniform. Next is, if possible, add another person if available to assist and grasp mattress securely and shift it up to head of the bed. And then next is I will assist the patient to turn toward opposite side of the bed and reposition the pillow under the patient's head. So the rationale for this is this allows the bed to be made on the vacant side. Next is I will loosen all bottom linens from the head, foot, and side of the bed.
So the rationale for this is this facilitates removal of linens. I will fold soiled linens as close to the patient as possible. Next is I will use clean linen and make the near side of the bed. Place the bottom sheet with its center fold in the center of the bed. I will open the sheet and fan fold to the center, positioning it under the old linen. So I will pull the bottom sheet over the corners at the head and foot of the mattress. So now I will remove gloves because I will touch a clean linen. Then if using, I will place the draw sheet with its center fold in the center of the bed and position so it will be located under the patient's midsection. I will open the draw sheet and fan fold to the center of the mattress. I will tuck the draw sheet securely under the mattress, and if a protective pad is used, place it over the draw sheet in the proper area and open to the center fold. Not all agencies use draw sheets routinely. The nurse may decide to use one. So I will raise the side rail. I will assist patient to roll over to the folded linen in the middle of the bed towards me. And I will reposition the pillow and back blanket or the top sheet. Move to the other side of the bed and lower the side rail. And then next is I will loosen and remove all bottom linens. Discard soiled linen in the laundry bag or hamper and do not place on the floor or furniture. Do not hold soiled linens against my uniform. So next is ease clean linen from under the patient. I will pull the bottom sheet and secure at the corners at the head and foot of the mattress. So pull the draw sheet tight and smooth. I will tuck the draw sheet securely under the mattress. So the rationale for this is this removes wrinkles and creases in the linens which are uncomfortable. And then next is I will assist the patient to turn back to the center of the bed. I will remove the pillow and change pillowcase. Open each pillowcase in the same manner as I opened other linens. So I will gather the pillowcase over one hand toward the close end, grasp the pillow with the hand inside the pillowcase and keep a firm hold onto the top of the pillow and pull the cover onto the pillow. So place the pillow under the patient's head after that. And then next is I will apply top linen, sheet, and blanket if desired so that it is centered. I will fold the top linens over the patient's shoulder to make a cuff. And then have patient hold on the top linen and remove the back blanket from underneath. So the rationale for this is this allows bottom hems to be tucked securely under the mattress and provides for privacy. And then next is I will secure the top linens under the foot of the mattress and meter the corners. So loosen top linens over patient's feet by grasping them in the area of the feet and pulling gently toward foot of the bed. So I will return the patient to a position of comfort. I will remove any PPE if I am wearing one and raise side rail and lower the bed and reattach the call bell. So the rationale for this is this promotes patient's comfort and safety. Removing gloves or any PPE properly reduces the risk for infection transmissions and contamination of other items. So I will now bring the patient back into a comfortable position. So comfortable naman po ba kayo? Okay. So next is I will remove my PPE and reattach the call bell. So assume that already reattach the call bell. raise the side rail, and lower the bed to a comfortable position for the patient. Next is I will dispose the soiled linens according to agency policy. So the rationale for this is deters the spread of microorganisms. So as Shumit already disposed the soiled linens, and then next is I will remove any other excess PPE if used, and then perform hand hygiene. So the rationale for this is removing PPE properly reduces the risk for infection, transmission, and contamination of other items. Hand hygiene prevents the spread of microorganisms. So I already removed my other PPEs, and I will now perform hand hygiene.